Canada's response to COVID-19 is like nothing we've ever seen before. Large segments of the economy shut down, schools closed, fines given out to people not physically distancing. There are now, more than 100,000 confirmed cases in this country. So the question on a lot of people's minds, I don't know if you guys are having this conversation at home with your families and friends, but was this all necessary? Joining me now for a look at some of the lessons learned is infectious diseases specialist Dr. Zain Chagla. Good to have you on the show this morning.
Hi, thanks for having me.
So I'm obviously recognizing we are still in this, we're still in a pandemic, but when we look at the last couple of months and analyze that, what have we gotten right and what has not gone so well?
I mean, I think we've learned a lot about COVID-19. In terms of the patients that were in hospital, I think we were very prepared and managed them very well. But there are some lessons learned for sure. I think number one is we didn't understand the scale of what could happen in a global pandemic on the things that we need for our day-to-day functioning. So the fact that this pandemic hit China meant most of our PPE supplies, which we import from China, were drastically reduced. The fact that this pandemic hit the world means those reagents and swabs that we use to test for COVID-19 were held up, and in some cases we're still dealing with supply chain issues in terms of testing. And then finally, I think we didn't know what the damage could have been done in long-term care, even though every year we deal with respiratory virus outbreaks in long-term care, but many of us didn't realize the breadth and how profound this would be in terms of hitting long-term care.
Yeah, I want to talk about that now. I mean, according to the National Institute on Aging, they were reporting in May that 82% of deaths were all in long-term care facilities. Mm-hmm. What should we have done differently?
So I think, again, we did a great job protecting our hospitals, and for the most part, our hospitals have that built-in infrastructure around infection control practices. We deal with highly resistant and contagious pathogens on a day-to-day basis. Long-term care facilities, as we're learning, have had issues for many, many years prior to this, but on top of that, we have patients that are cohorted together. We had not perfect education around how to use personal protective equipment appropriately. We had people coming in and out of these care facilities. We had staffing levels that weren't appropriate for the level of care that were needed for those patients. And it's the perfect storm. If the disease gets in the door, and it did through multiple care homes and it's still getting it through multiple care homes, it sweeps like fire, and multiple patients get infected at any given time.
Was it necessary to shut down portions of the economy, in your opinion?
Yes, I think so. I mean, we were dealing with a profound spread, and we had seen the models of what was happening in Italy, in northern Italy. We had seen what was happening in New York, which is, one of the epicenters of commerce in the world, where you're seeing a scale of infection above anywhere else in the world prior. I think, those catastrophic scenarios are still extreme, and at the end of the day, we didn't have as big of a wave as we expected, but we don't really go back and remember what could have happened. We remember what happened. So no one remembers a medical intervention that's preventative for the sake that they didn't get cancer or didn't have a heart attack. They just remember the medical intervention they had. And similar to this, we go back and we remember, okay, we didn't have a lot of cases. Our hospitals dealt with patients, but we were not certainly overwhelmed. But no one is going to ever remember that catastrophic scenario where we wouldn't be able to house people in hospitals, where people would be dying outside of hospitals, and the success we had from that.
Doctor, if we could go back to the beginning of this, you're sitting around a boardroom table at the start of this pandemic, and you could give one piece of advice to everybody there on how to proceed. What would you say?
I think, as I emphasized earlier, one of our biggest challenges here was education in terms of all settings. And I think, it would be an all hands on deck that hospitals, regional health networks, public health networks, long-term care facilities, all of these places would coordinate a concerted effort to make sure their staff are trained, that we have appropriate and available PPE, and people know how to use it appropriately. That would have been the biggest lesson, and I think we could have definitely prevented some of these downstream effects in that sense.
Dr. Zain Chagla, we appreciate your time. Thank you.
No problem. Take care.
Thanks for watching. If you like this, be sure to subscribe here. And you can check out more Your Morning videos right here.